Welcome to our discussion on leadership styles. Today we will be starting by comparing two popular styles, transformational leadership and servant leadership. Transformational leadership is a style where leaders inspire and motivate their team members to exceed their own individual performance goals and achieve a greater collective purpose. This style of leadership is characterized by its focus on inspiration and motivation. Transformational leaders prioritize patient care and encourage innovation within their teams. Let's take a look at the key characteristics of transformational leadership. They are leaders who inspire their team to exceed their own individual performance goals. Patient care is also a top priority for these leaders. They ensure that their team is always focused on providing the best care possible. They are not afraid of change and encourage their team members to think outside the box and come up with innovative solutions. On the other hand, servant leadership is a leadership style where the leaders prioritize the needs of the team and the patients over their own. This style of leadership is characterized by its focus on the growth and well-being of the team members. Now let's take a look at the key characteristics of servant leadership. Their leaders are always there for their team members. They provide support and guidance whenever needed. They prioritize the growth of their team, and they prioritize opportunities for learning and development to help their members grow both personally and professionally. They are known for their supportive nature and are always ready to lend a hand and help their team members in any way they can. On our next slide, we delve further into transformational leadership, a style that inspires and motivates team members to exceed their individual performance goals and contribute to the organization's greater good. This leadership style is particularly effective in healthcare settings, including occupational therapy. Transformational leaders in OT have several key characteristics. First, they prioritize patient-centered care, aligning with the core values of occupational therapy. They encourage team members to view situations from the patient's perspective, fostering empathy and improving patient outcomes. Secondly, they promote the use of evidence-based practice, which is a key component of OT. They encourage team members to use the latest research and data to inform their decisions, leading to more effective treatments and interventions. Thirdly, they create a culture of continuous learning and improvement, and encourage team members to seek out new knowledge and skills, fostering professional development and improving quality of care. Fourthly, they foster a collaborative environment, which is crucial in OT, where multidisciplinary teams often work together to provide comprehensive care. They promote open communication, leading to better patient outcomes. Lastly, they inspire and motivate their team members, leading to increased job satisfaction and reduced turnover. This is particularly important in OT, where burnout can be a significant issue. On slide 4, we will be discussing the concept of servant leadership. According to a systematic review completed in 2024, servant leadership is a leadership style that prioritizes the needs of team members, encouraging their personal growth and fostering a sense of community. It can be found to be particularly effective in healthcare settings, including OT. This is because servant leaders show empathy and listening. They emphasize empathy and listening and align perfectly with the patient-centered approach of OT. Therapists need to understand the unique goals and needs of their patients to provide effective treatment. Servant leaders foster a collaborative environment, and this is crucial in OT, where therapists often work in multidisciplinary teams and need to collaborate effectively with other healthcare professionals. Servant leaders focus on the growth and development of their team members, and in OT, this can lead to more skilled and confident therapists, ultimately improving patient outcomes. Lastly, servant leaders build strong communities, and this can enhance the supportive environment necessary for OT. On slide 5, we'll discuss the importance of understanding one's leadership style in the healthcare sector. Leadership styles in healthcare are not just a theoretical concept, but a critical element that can break or make the success of healthcare organizations. They have a profound influence on various aspects of the organization, such as communication, team performance, patient outcomes, and the overall culture of the organization. First, different leadership styles have different communication methods. By understanding their own style, leaders can communicate more effectively with their team. This leads to better understanding, cooperation, and ultimately improved team performance. Second, a leader's style can significantly impact the team's performance. A leader who is supportive and encourages open communication can foster a positive work environment, leading to higher productivity and efficiency. The leadership style can also affect patient outcomes. Effective leaders can lead to better patient care, improved patient satisfaction, and ultimately better health outcomes. Fourthly, the leadership style contributes to the positive leadership style can foster a positive culture, leading to higher job satisfaction among employees and lower turnover rates. Lastly, leaders with a good understanding of their leadership style can manage change more effectively. This ensures that the organization adapts and thrives in the ever-changing healthcare environment. Slide 6 presents the key skills and behaviors that, according to Weiss, Tillen, and Morgan's 2023 study, are essential for effective leadership in fostering diversity and inclusion. First, there's cultural competence. Leaders should possess a deep understanding and appreciation of different cultures, backgrounds, and experiences. This involves being conscious of one's own biases and prejudices and making a concerted effort to overcome them. Next, we have communication. Effective communication is a cornerstone in creating an inclusive environment. Leaders must be adept at clearly articulating their expectations and providing feedback in a manner that is both respectful and constructive. Then we have empathy. Leaders should demonstrate empathy towards their team members, acknowledging their unique experiences and perspectives. This fosters trust and promotes a sense of belonging within the team. The fourth skill is conflict resolution. Leaders should be proficient in resolving conflicts in a fair and equitable manner. This includes the ability to mediate disputes and facilitate discussions to reach a consensus. Lastly, we have role modeling. Leaders should exemplify the behaviors they expect from their team members. This includes treating everyone with respect and dignity regardless of their background or identity. In slide 7, we'll discuss another crucial aspect of leadership, which is professionalism and professional responsibility. Ethical behavior. Leaders should always adhere to the highest ethical standards. This means acting with integrity and honesty at all times. They should be role models for their team, setting the standard for ethical conduct. Leaders should take responsibility for their actions and decisions. They should also hold their team members accountable. This fosters a culture of responsibility and trust within the team. They should always be committed to continuous learning and development. This is just not for themselves, but also for their team members. This means staying updated on the latest research and best practices in their field and encouraging their team members to do the same. Lastly, leaders should be committed to serving others. This means putting the needs of their team members and the organization before their own. Selfless service is a hallmark of great leadership. Slide 8 and 9 focuses on the significant influence of various factors on leadership styles. These factors include personal, organizational, societal, multicultural, and global norms and values. Let's start with personal norms and values. These are the individual's beliefs and principles that guide their behavior, and they can significantly impact a leader's style. For instance, a leader with a strong value for teamwork may adopt a more democratic or participative leadership style, encouraging input from all their team members. Next, we have organizational norms and values. These refer to the shared beliefs, principles, and standards within the organization. These can shape a leader's style by dictating the acceptable and expected behaviors within the organization. For example, an organization that values innovation may foster a transformational leadership style. In this style, leaders inspire and motivate their teams to think creatively and challenge the status quo. Then there are the societal norms and values. These are the shared expectations and rules that guide behavior within a society. They can significantly shape a leader's understanding of their role and responsibilities. For instance, in a society that values hierarchy and respect for authority, leaders may adopt a more autocratic style. Next, we have multicultural norms and values, and these refer to the diverse beliefs and practices of different cultural groups. They can impact a leader's style by requiring them to adapt to a diverse need and expectations of their multicultural teams. A leader working in a multicultural environment may need to adopt a more inclusive and flexible leadership style. And lastly, there's global norms and values. These are the shared principles and styles that guide international behavior. They can influence a leader's style by shaping their understanding of their role in a global context. A leader in a global organization may need to adopt a more transformational style, inspiring and motivating their teams to work towards global goals. Lastly, we have slide 10 and 11, which focuses on the intersection of the Christian worldview and leadership in healthcare. The Christian worldview upholds principles of human value and dignity, which align with the norms and values that impact leadership in healthcare. These principles are reflected in the way healthcare leaders approach their roles and responsibilities. First, we have human value. The Christian worldview emphasizes the intrinsic value of every human being, and this aligns with the healthcare leadership principle of patient-centered care, which places the needs and values of patients at the forefront of healthcare and delivery. According to a publication in 2023, healthcare leaders who embrace this principle strive to ensure that all patients receive care that is respectful and responsive to their individual needs, preferences, and values. This approach recognizes the inherent value of each patient and seeks to honor that value in the provision of care. In essence, the Christian worldview emphasis on human value aligns seamlessly with the patient-centered approach and healthcare leadership, fostering a culture of respect and dignity in the healthcare setting. Now let's talk about human dignity. The Christian worldview upholds the principle of human dignity, asserting that all individuals deserve to be treated with respect and dignity. This aligns with the healthcare leadership value of respect for persons, which is fundamental to ethical healthcare practice. The authors note that healthcare leaders who uphold this value strive to ensure that all patients are treated with respect regardless of their health issues, cultural backgrounds, or other personal characteristics. This approach recognizes the inherent dignity of each patient and seeks to honor that dignity in the provision of care. Lastly, is cultural religious competence. Martin also highlights the importance of this competence in clinical practice. This involves understanding and respecting the religious and cultural beliefs of patients, which can significantly impact their healthcare experiences and outcomes. This aligns with the Christian worldview principle of love for neighbors, which calls for understanding, empathy, and respect for the beliefs and values of others. Healthcare leaders who uphold this principle strive to provide care that is sensitive to the cultural and religious beliefs of their patients, recognizing that these beliefs are an integral part of their identity and dignity.